Hello, and welcome to our channel. In this comprehensive video, we dive deep into challenging nursing questions related to chest tube, tailored for both NCLEX and Prometric exams. Join us to enhance your knowledge and critical thinking skills as we provide detailed answers and thorough rationales to help you succeed in your nursing career. Whether you're a student preparing for exams or a healthcare professional seeking to strengthen your expertise, this video will be an invaluable resource. Question 1. A patient with a chest tube experiences sudden, excessive bubbling in the water-sealed chamber of the drainage system. What is the nurse's initial action? A. Clamp the chest tube immediately. B. Check for kinks or obstructions in the tubing. C. Increase the suction pressure on the drainage system. D. Administer oxygen to the patient. Answer 1. B. Check for kinks or obstructions in the tubing. Rationale: sudden, excessive bubbling in the water-sealed chamber of a chest tube drainage system indicates an air leak. The first action the nurse should take is to check the tubing for kinks, obstructions, or disconnections. Clamping the chest tube or increasing suction pressure is not appropriate and could worsen the situation. Administering oxygen may be necessary but should come after addressing the cause of the air leak. Question 2. A patient with a chest tube drainage system reports severe pain at the chest tube insertion site. What is the nurse's priority action? A. Administer a prescribed analgesic. B. Check for subcutaneous emphysema. C. Assess the patient's respiratory rate and oxygen saturation. D. Document the patient's complaint in the chart. Answer 2. C. Assess the patient's respiratory rate and oxygen saturation. Rationale: severe pain at the chest tube insertion site could be indicative of a complication, such as a pneumothorax. The nurse's priority action should be to assess the patient's respiratory status by checking the respiratory rate and oxygen saturation. Administering analgesics or documenting the complaint can be done after ensuring the patient's respiratory stability. Subcutaneous emphysema may also be assessed, but it is not the priority in this case. Question 3. A patient with a chest tube accidentally pulled out the chest tube from the insertion site. What should the nurse do first? A. Reinsert the chest tube at the same site. B. Apply an airtight occlusive dressing. C. Call the healthcare provider for orders. D. Administer pain medication to the patient. Answer 3. B. Apply an airtight occlusive dressing. Rationale: if a patient accidentally pulls out a chest tube, the nurse's initial action is to apply an airtight occlusive dressing over the insertion site. This helps prevent air from entering the pleural space and causing a pneumothorax. The healthcare provider should be called for further instructions, which may include reinserting the chest tube. Administering pain medication can be considered after securing the site. Question 4. The nurse is caring for a patient with a chest tube and observes that the drainage system's water-sealed chamber has fluctuating water levels with each breath. What does this observation indicate? A. Pneumothorax is developing. B. The chest tube is functioning properly. C. The patient has a blocked chest tube. D. The chest tube needs to be clamped. Answer 4. B. The chest tube is functioning properly. Rationale: fluctuating water levels in the water-sealed chamber of the chest tube drainage system with each breath indicate that the chest tube is functioning correctly. This is a normal observation, and it demonstrates that the system is effectively draining air and fluid from the pleural space. A pneumothorax, a blocked chest tube, or the need to clamp the chest tube are not indicated by this finding. Question 5. A patient with a chest tube complains of feeling short of breath and experiences sudden chest pain. The nurse notes that the chest tube drainage system has stopped fluctuating. What is the nurse's priority action? A. Assess the patient's respiratory rate and oxygen saturation. B. Administer pain medication to the patient. C. Call the healthcare provider for orders. D. Clamp the chest tube immediately. Answer 5. Assess the patient's respiratory rate and oxygen saturation. Rationale: the patient's complaint of shortness of breath and sudden chest pain, along with the cessation of fluctuation in the chest tube drainage system, may indicate a tension pneumothorax. The nurse's priority action should be to assess the patient's respiratory status by checking the respiratory rate and oxygen saturation. This is a life-threatening emergency. Calling the healthcare provider and administering pain medication can follow. But addressing the patient's respiratory distress is the immediate concern. Clamping the chest tube is not appropriate in this situation. Question 6. A nurse is assessing a patient with a chest tube drainage system and observes continuous bubbling in the water-sealed chamber. What does this finding most likely indicate? A normal functioning of the chest tube. B. A blockage in the chest tube. C. A pneumothorax. 500. An air leak in the system. Answer 6. D. An air leak in the system. Rationale: continuous bubbling in the water-sealed chamber of a chest tube drainage system indicates an air leak. This suggests that air is escaping into the system rather than being properly evacuated from the pleural space, which is abnormal. The nurse should investigate the source of the air leak. Question 7. A patient with a chest tube is being prepared for discharge. What instructions should the nurse provide to the patient regarding chest tube care at home? A. You can remove the chest tube once you're home. B. Avoid getting the water-sealed chamber wet during a shower. C. You should clamp the chest tube before ambulating. D. It's safe to resume your normal activities immediately. Answer 7. B. Avoid getting the water-sealed chamber wet during a shower. Rationale: patients with chest tubes should not remove the chest tube themselves, as it requires healthcare provider intervention. The water-sealed chamber should be kept dry to prevent disruptions in the chest tube's function. Clamping the chest tube while ambulating is not recommended, as it can lead to complications. Patients may need to gradually resume activities, but this should be guided by their healthcare provider. Question 8. A patient with a chest tube reports severe respiratory distress and complains of excessive chest pain. The nurse notices that the chest tube drainage has suddenly decreased. What is the most likely cause of these symptoms? Infection at the chest tube insertion site. B. Pleural effusion. C. Tube dislodgement or kinking. D. Lung consolidation. Answer 8. C. Tube dislodgement or kinking. Rationale: severe respiratory distress, chest pain, and a sudden decrease in chest tube drainage can be indicative of tube dislodgement or kinking. It is essential to assess the chest tube's integrity and placement to address the issue promptly. Question 9. A patient with a chest tube is on suction to remove air from the pleural space. The nurse notes that the suction control chamber in the drainage system is bubbling continuously. What is the appropriate nursing action? A. Increase the suction pressure to enhance chest tube function. B. Assess the patient's vital signs and respiratory status. C. Clamp the chest tube to prevent further air leak. D. Document the findings and continue monitoring. Answer 9. B. Assess the patient's vital signs and respiratory status. Rationale: continuous bubbling in the suction control chamber of the chest tube drainage system suggests that the suction is functioning as intended. The nurse should assess the patient's vital signs and respiratory status to ensure that the therapy is having the desired effect. Increasing suction pressure is not indicated. Clamping the chest tube is not appropriate, and documentation should follow assessment. Question 10. A patient with a chest tube complains of pain during deep breathing and coughing. What is the nurse's most appropriate intervention? Administer pain medication as ordered. B. Instruct the patient to avoid deep breathing and coughing. C. Encourage the patient to perform incentive spirometry. D. Increase the suction pressure on the chest tube. Answer 10. C. Encourage the patient to perform incentive spirometry. Rationale: encouraging the patient to perform incentive spirometry is an appropriate intervention for managing pain during deep breathing and coughing. It helps to improve lung function and prevent atelectasis without the side effects associated with pain medication. Administering pain medication as ordered may still be necessary, but it should not replace non-pharmacological measures for lung expansion. Increasing suction pressure is not indicated for pain management. Question 11. A nurse is caring for a patient with a chest tube. The nurse observes continuous bubbling in the water-sealed chamber, and the fluid in the chamber is decreasing. What is the most likely cause of this observation? A blocked chest tube. B. A pneumothorax. See a malfunction in the drainage system. 500 an air leak in the system. Answer 11, D an air leak in the system. Rationale, continuous bubbling in the water-sealed chamber with a decrease in fluid level indicates an ongoing air leak in the chest tube system. This suggests that air is escaping into the system, which can be problematic and should be investigated further. Question 12. A patient with a chest tube is experiencing severe pain at the insertion site. The nurse assesses subcutaneous emphysema and notes that the chest tube is intact and functioning properly. What is the most likely cause of this pain? An infection at the chest tube insertion site. B. Inflammation at the pleural space. C. Irritation of the intercostal nerves. D. A kink in the chest tube. Answer 12. C. Irritation of the intercostal nerves. Rationale. Severe pain at the chest tube insertion site in the presence of subcutaneous emphysema with an intact and functioning chest tube is often due to irritation of the intercostal nerves. The pressure from trapped air in the subcutaneous tissues can irritate these nerves, causing pain, infection, inflammation, or a kink in the chest tube would likely manifest differently. Question 13. A patient with a chest tube is scheduled for a chest X-ray. The nurse wants to ensure that the chest tube remains patent during the procedure. What action should the nurse take? A. Clamp the chest tube during the X-ray. B. Disconnect the chest tube from the drainage system. C. Ask the patient to take deep breaths during the X-ray. D. Ensure the chest tube is attached to the drainage system with no obstructions. Answer 13. D. Ensure the chest tube is attached to the drainage system with no obstructions. Rationale. During a chest X-ray, it is important to ensure that the chest tube remains patent. The nurse should confirm that the chest tube is securely attached to the drainage system with no obstructions. Clamping the chest tube or disconnecting it is not appropriate and can lead to complications. Asking the patient to take deep breaths during the X-ray is unrelated to chest tube patency. Question 14. A patient with a chest tube is ambulating in the hallway. The nurse notices that the chest tube drainage suddenly stops, and the water-sealed chamber is full of fluid. What should the nurse do first? A. Clamp the chest tube immediately. B. Assess the patient's vital signs and respiratory status. C. Call the healthcare provider for orders. D. Document the findings in the patient's chart. Answer 14. B. Assess the patient's vital signs and respiratory status. Rationale. If the chest tube drainage suddenly stops and the water-sealed chamber is full of fluid, it may indicate a blockage in the chest tube. The nurse's initial action should be to assess the patient's vital signs and respiratory status too. Determine if this change is affecting the patient's condition. Clamping the chest tube without a thorough assessment is not advisable. Calling the healthcare provider and documenting the findings should follow the assessment. Question 15. A patient with a chest tube is receiving negative pressure suction to remove air from the pleural space. The nurse observes that the water in the water-sealed chamber is rising and falling with the patient's respirations. What does this observation indicate? A. The chest tube is functioning properly. B. A blockage in the chest tube. C. The patient is experiencing a pneumothorax. D. The chest tube needs to be clamped. Answer 15. A. The chest tube is functioning properly. Rationale. The rising and falling of water in the water-sealed chamber with the patient's respirations indicates normal chest tube functioning. It shows that air is being evacuated from the pleural space during exhalation and prevents air from entering during inhalation. No immediate action is required in this case, as it is a typical observation. Question 16. A nurse is caring for a patient with a chest tube and notices that there is no fluctuation in the water-sealed chamber. What is the nurse's initial action? A. Call the healthcare provider for orders. B. Clamp the chest tube immediately. C. Assess the patient's vital signs and respiratory status. D. Document the findings in the patient's chart. Answer 16. C. Assess the patient's vital signs and respiratory status. Rationale. The absence of fluctuation in the water-sealed chamber may indicate a problem with the chest tube, such as a blockage or a disconnection. The nurse's initial action should be to assess the patient's vital signs and respiratory status too. Determine if this change is affecting the patient's condition. Calling the healthcare provider and documentation can follow the assessment. Question 17. A patient with a chest tube has excessive bright red blood in the collection chamber. What is the nurse's most appropriate action? A. Notify the healthcare provider immediately. B. Administer pain medication as ordered. C. Document the findings and continue monitoring. D. Increase the suction pressure on the chest tube. Answer 17. And notify the healthcare provider immediately. Rationale: excessive bright red blood in the chest tube collection chamber may indicate active bleeding, which is a critical concern. The nurse should notify the healthcare provider immediately for further evaluation and intervention. Administering pain medication, documentation, or increasing suction pressure would not address the underlying issue of bleeding. Question 18. A patient with a chest tube experiences sudden, severe respiratory distress, tachycardia, and hypotension. The nurse suspects tension pneumothorax. What is the nurse's priority action? A. Administer oxygen to the patient. B. Clamp the chest tube immediately. C. Call a code and prepare for emergency needle decompression. D. Document the patient's symptoms. Answer 18. C. Call a code and prepare for emergency needle decompression. Rationale: sudden, severe respiratory distress, tachycardia, and hypotension are classic signs of tension pneumothorax, which is a life-threatening emergency. The nurse's priority action is to call a code and prepare for emergency needle decompression to relieve the pressure in the pleural space. Administering oxygen and documenting the symptoms should be secondary actions. Question 19. A patient with a chest tube is scheduled for a chest X-ray. The nurse is reviewing the physician's orders and notices that there are no specific orders related to the chest tube during the X-ray. What action should the nurse take? A. Disconnect the chest tube from the drainage system. B. Clamp the chest tube during the X-ray. C. Ensure that the chest tube is securely attached to the drainage system. D. Ask the patient to perform deep breathing exercises during the X-ray. Answer 19. C. Ensure that the chest tube is securely attached to the drainage system. Rationale: during a chest X-ray, it is important to ensure that the chest tube remains securely attached to the drainage system to prevent air leaks or disconnections. Disconnecting or clamping the chest tube is not recommended during this procedure, and it can lead to complications. Asking the patient to perform deep breathing exercises during the X-ray is unrelated to chest tube management. Question 20. A patient with a chest tube reports feeling lightheaded and dizzy. The nurse observes that the water seal chamber in the chest tube drainage system is fluctuating excessively. What could be the cause of the patient's symptoms? A. Increased suction pressure in the drainage system. B. Inadequate drainage from the pleural space. C. Hyperventilation by the patient. D. An air leak in the system. Answer 20. A. Increased suction pressure in the drainage system. Rationale: excessive fluctuation in the water seal chamber can indicate increased suction pressure in the chest tube drainage system, which can lead to rapid evacuation of air and fluid from the pleural space. This can cause symptoms of lightheadedness and dizziness in the patient. The nurse should check and adjust the suction pressure as needed. Inadequate drainage, hyperventilation by the patient, or an air leak in the system would not typically cause these symptoms.